information to share today. We're going to have my colleague Supervisor Fletcher with us today, who's going to provide an update on the charts and graphs, tracking case numbers and other important data. And then we're going to hear from Dr. Wilma Wooten with an update on the medical front, and then we'll go directly to the media questions. As you know, earlier this week, the county eased its restrictions on individual water activities at the beaches, allowing people to swim, surf, and kayak. Let me tell you, that was not an easy decision. Our main priority has been public health and stopping the spread of this disease, and we've been very careful to listen to our medical experts and follow their data. After considering all those factors, we eased back our restrictions on access to the beach. We know where beaches are special to Southern Californians and more specifically to San Diegans. They are a place for exercise and contemplation, a place we visit for birthday parties, celebrations, and other special occasions. As a supervisor, I've been fortunate to represent communities with miles of beaches from Imperial Beach to Coronado and San Diego Bay in between. I also had the fortune to serve on the California Coastal Commission, whose primary goal has always been to make sure Californians have easy access to our beaches. So that's why I was a little shocked last night to hear the news that the governor was reportedly going to close California beaches. So early this morning, I sent a letter asking him to reconsider any such decision, and I know some of my colleagues also sent similar letters. But I do want to highlight one individual in particular, my COVID subcommittee co-chair, Supervisor Nathan Fletcher, who was able to make direct contact with the governor to highlight the efforts and good work we're doing here in San Diego County to flatten the curve. Today, the governor clarified his order to announce that his order will only apply to Orange County as far as closing beaches where there were obvious violations last weekend regarding social distancing rules. I want to thank Governor Newsom for listening to our concerns and taking into consideration the great work we're doing here in San Diego County by you, our citizens, and even giving us a shout out in his press conference recognizing the great work that San Diego County is doing. San Diegans, let's continue to practice social distancing at our beaches so that we can continue to enjoy them. Let's not do anything that ends our endless summer. In the meantime, we will remain committed to following the state's orders and directions on health measures to defeat COVID-19. And today, we are going to be announcing some updates to our public health order that will strike a balance between tightening and loosening our response to this pandemic. As you've already heard, the order is to expire that we had in existence today at midnight, but we will be continuing it until the medical situation and the state's guidelines allow us to end it. This order has a few amendments, so we're going to be covering some of them, and Supervisor Fletcher will be covering a couple of other ones that I won't highlight. As we've said all week, starting tomorrow, May 1st, we will be directing all San Diegans to wear facial coverings when they go out in public. We are directing that when you go outside, take your covering with you at all times and be prepared to use it. That covering doesn't have to be a surgical mask, a bandana, a scarf, or a homemade covering like the one I have will do. There are plenty of tutorials online to make one and from the materials that you probably have in your home. Now, when to use it? Let's say, for example, you're walking in your neighborhood to get some exercise. Take your mask, put it around your neck, and have it ready. Now, if you're walking by yourself and there's no one around, it's okay to lower the mask. But as soon as you see someone walking towards you or someone in their front yard, even before they get within 6 feet, we want you to pull that face covering up above your nose and mouth. Same thing goes for at work. If you're at work and standing or sitting close to someone, cover up. But if you're alone or if you're alone in your car driving to work, it's okay to lower your face covering. And if you stop at a drive-thru to order food, please be courteous and keep your covering on. We've gotten pretty used to wearing something like these facial coverings over these last few weeks, and hopefully this shouldn't be a big adjustment. Remember the adage, I protect you, you protect me. In addition, we're going to be making some changes to the order to ease some restrictions on golf courses. To enhance recreational opportunities, private and public golf courses may be open for limited use provided the owner or operator of the golf course has completed and fully implemented a physical distancing and safety plan and submitted a copy of that completed form to the public health officer at least 2 days prior to opening. We are asking golf courses to conduct temperature screening of all employees and customers and bar anyone with a temperature of 100 degrees or higher. I know many of you have been eager to get out and golf, so please enjoy your opportunity responsibly. But no high fives tomorrow, no hanging out in groups, no using carts. We want you to walk the course so there's some distance between you and other players. And remember to always replace your divots. Actually, that last part is not in the order, it's just proper golf etiquette. As a reminder, our updated public health order can be found on the coronavirus website at coronavirus-sd.com. Let's continue with today's briefing, and I'll bring up Supervisor Fletcher.
Thank you, and good afternoon. San Diegans continue to step up. We're seeing progress. We're seeing continued advancement, and so today we are continuing to move forward with some additional easings of restrictions around parks, outdoor recreational opportunities, and recreational boating. But as we move forward, it is critically important that we not lose our focus, that we not lose our commitment, that we not lose our adherence to all of the things that we are doing to slow the spread of COVID-19. That means as we begin to gradually turn the dial, we have to double down our efforts around physical distancing, face covering, ensuring proper things like hand washing. We have done a good job as a region in flattening the curve and buying ourselves time to build up our capacity, but we do not want to throw away all of that progress by losing our focus as we begin to move forward. We want to continue to move forward. We don't want to see a situation where we have to dial back or turn back. And I think that is particularly important as we head into this weekend. The first weekend where a lot of these things are opened up and accessible, we want to make sure that we continue to be responsible and exercise restraint. We have done a good job to date. Let's keep that moving. Speaking of doing a good job, today Governor Gavin Newsom praised specifically the actions of San Diego. He held us up as a model, and he praised the way that we've gone about the things that we've done. But in that same press conference, he simultaneously pointed out other areas of the state where they have not been as successful in physical distancing, and they have not been as successful in moving forward, particularly with their beaches. Those areas of the states are now being closed and moving backwards. We do not want that to be us, and so let's continue the incredible level of cooperation that we've seen and ensure that as a region we continue to be a model and we continue to be held up and we continue to move forward. There was a lot of activity and a lot of interest about what the governor was talking about or going to talk about today, and I think that there's two lessons that we should all take away from what happened today. The first is the danger to the public remains high. In 2 months' time, more than 60,000 Americans have died of coronavirus. It continues to be very contagious. It continues to have the same ability to overwhelm our healthcare system and dramatically impact our way of life. And so as we ease some of these restrictions, it is vitally important that we continue to exercise restraint, that we continue to adhere to the orders, we continue to follow physical distancing and face coverings. If we do that, we can continue to see success. If not, as was the case today with Orange County and their beaches, which are now closed, the same thing could happen to us here in San Diego, either via the governor or via our own public health officer, who every one of these steps we take, if it becomes something that is compromising public health, we've always said the dial could be turned back. Let's not have that be us. Let's continue to move forward. And then the second takeaway from what happened today is it's vitally important that we wait for official guidance from the official source before we assume what decisions are going to be made. If there is a major announcement from the state of California, the governor will share it with us himself at his press briefings. When I heard the rumor, along with many of you, I called the governor last night, and he said to me exactly, San Diego has been a model. We want to align the rest of the state to what you are doing. And so as we move forward in the difficult days ahead, and we do have difficult days ahead, we are going to have challenges, we're going to have bumps in the road, we're going to have uncertainty. Every now and then we're going to have miscommunication. As we move forward into this era, let us remain calm, let us remain cautious, and let us remain committed. Today we are making a number of modifications to our public health order. The first, which was mentioned, was extending the stay-at-home order just to be consistent with the state of California. We want to align with them as their order supersedes ours anyway, and so aligning the two together is more of an administrative function to ensure that we move forward together. The other ones, I think, will be of much greater interest to the public. There are orders around recreation and outdoor activities. It is, as we have said throughout the duration of this, not only is it okay to get outside, it is encouraged. It is encouraged to get outside, to exercise, to walk, to be with your family, to get some sun. We just want to do it responsibly. And so today, we are making some changes around parks. Now, to reiterate on parks, local jurisdictions have the authority and ability to choose whether to open or close their parks. They also have the ability to be more restrictive, but not less restrictive than the County of San Diego. We have been working with our local jurisdictions for the better part of the past 2 weeks, and we are now in a position where we can begin easing some of the countywide restrictions that applied to all parks. And so those that we are easing in this current restriction are single family households may participate in active sports activities. Now, to be clear, this does not mean all of your family members who live in different households can come together. It means the individuals who live in one household can go out and play together, whether that be soccer or baseball or frisbee or any of those types of things, but only members of a household. Non-household gatherings may not participate in active sports activities. We are also lifting half of the restrictions on parking lots in parks only. So local jurisdictions may choose to utilize up to 50% of their parking capacity, and locals must have a physical distancing plan that is enforceable, that is appropriately staffed, and ensures that our parks are visited and frequented in a responsible way. And so that order is going into effect. The second one I know will be of great interest to our recreational boating community is that we are lifting the restrictions on recreational boating in our bays, lakes, and ocean. The restriction is that a single household may participate in recreational boating in lakes, bays, and oceans. Again, this is a household. It is limited to households. So no family reunions. When we say a single family, that does not mean every family member you've ever met. It means family members who reside in your household or individuals who are in your household may be out on a boat. No party boats, no party barges. Let's be responsible with this and get out and enjoy this in the appropriate way. When it comes to beaches, we've made very little changes, a few modest clarifications, but the general situation around beaches remains essentially the same. All beach parking lots shall remain closed. Beaches may be used solely for walking, running, hiking, equestrian or bicycle riding where appropriate and authorized by that local jurisdiction. In the water, you can swim, body surf, boogie board, surf, kite surfing, paddle boarding, kayaking, snorkeling, and scuba diving are explicitly allowed in the order. Beaches where social distancing requirements cannot be effectively implemented and enforced by local jurisdictions shall close, and the implementation of these is at the discretion of the appropriate jurisdiction, whether that be a city or the state of California. Local jurisdictions have the ability and discretion to open at their pleasure, to close at their pleasure, or to limit things in ways beyond how we have limited those things. The hope is that as we come out of this, that we can continue to change how we go about life. There is a question of how do you come out of a very restrictive environment and not get a significant spread, and the way that we do that is by the modifications we've all made to our way of life. By coming out of this and really being committed to physically distancing, by coming out of this and being committed to face coverings, by coming out of this and being very committed to hand washing and hygiene, coming out of this and knowing the actions we take if we feel sick. If we do all of those things, only congregating with members of your own household, if we do all of those things, then we believe that we can come out of this without seeing a significant spike in our number of cases, but we must continue to hold the line. The things that could change our continued progress in turning the dial would be a significant spike in our cases and our hospitalizations. That would force us to have to stop and begin to dial back. Or if our actions are not consistent with the guidance given. And as a region, we have done such an incredible job together, each and every one of us working to stay at home, to limit our activities, to slow the spread. Our actions have saved lives. As we now begin to move into a new phase, let's ensure that same level of commitment. Let's ensure that same level of action where each and every one of us are making a conscious choice and decision that we will go about our lives in a way that not only protects ourselves and protects others. And if we do that, then as a region, we can continue to see progress and continue to get through this together. A quick update on the homeless situation before we jump into our report from today. We're reporting out of all of the total number of cases in San Diego County, 3,564, 30 of them are unsheltered. Yesterday, 160 were tested at the convention center. We do not have those results yet, but we do have some results from yesterday to today. We have 62 more negatives than we had yesterday, so negatives tests are at 706. Indeterminate is the same. Pending results, 98 more than yesterday. So the total tests administered at the convention center, 1,129, with 2 positive. The rest either negative, indeterminate, or pending. And again, I will have an update for us tomorrow with our plan around T3, testing, tracing, and treatment, which is a key cornerstone of our efforts here at the county. With that, we'll jump quickly into our charts. Today, we're reporting 132 positive tests out of 2,303 total tests that were done. This is a percentage of 6%. Again, the number of tests are less important than the percentage of positive. 6% today is what we are reporting, fairly consistent with yesterday, down a little bit from the day before. Our rolling 14-day percentage and average is at 6.3%, and so we continue to trend in a good direction. We also continue to see testing climb. That is something, again, we would like to, as we move forward, get out of a little bit of the up and down nature of testing and get into more continual growth. There will be day-to-day variations. That's the nature of batching and testing, but we would like to see continued progress here. Our next one is our hospitalization. We're reporting currently 136 COVID-related individuals in ICU. 355 total hospitalizations, COVID suspected or COVID related. Again, you can see the general consistency that we have had here across the board. And then our last chart just shows our positives, our estimated recoveries at 1,963. Hospitalization, what is relevant there is the rate of doubling around hospitalizations at 24. ICU rate of doubling around 36. And again, the rate of doubling for positives is less important to us now as we are seeing an increase in testing. We are going to see an increase in positives, but we do closely monitor and watch the doubling rates of hospitalizations and deaths. That concludes my section. I'll now turn it over to Dr. Wilma Wooten for a public health officer's report.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and thank you for being here. As discussed yesterday, San Diego County has met 4 of the 5 metrics that comprise the federal gating criteria. These metrics must be met before the state and the region can consider proceeding to a phased opening approach. So we are currently in the state's stage 1 and awaiting further direction from the governor. Today you have heard some very positive news from our governor and about our local health officer's order. It is important to emphasize, however, that as we monitor our metrics, with slowly dialing down or loosening up the health officer's order, if we see a trend in the wrong direction of the 5 metrics because people are not following the health officer order, we can and will dial up again on the order. So beginning midnight tonight, everyone will be required to wear a facial covering, and we are extending the health officer's order until further notice to align with the governor's executive order. Tomorrow, we will again provide an overview of the 5 metrics, and give further detailed information about our T3 strategy of testing, tracing, and treatment, which includes isolation. So I hope you are all encouraged. As San Diego residents, you have done a great job over the past 6 weeks, and we thank you for all of your effort. Now, regarding global, national, and state statistics based on data obtained from the Johns Hopkins dashboard at about noon today, globally, we have had almost 3.3 million positive cases, including almost 231 deaths. Nationwide, we've had over 1 million positive cases, including almost 62,000 deaths. And for the state of California, we have had almost 49,000 positive cases, including almost 2,000 deaths. And today, for the county of San Diego, we are reporting 3,564 cases, which is 132 more cases than yesterday, as well as 124 deaths, which is 4 more than reported yesterday. In terms of the demographics related to our cases, the age range remains the same, from 3 months to 100 years of age. We have, in terms of individuals 20 to 49 years of age, there are 1,836, which is 52% of the total number of cases. We still have 49% of the cases being female and 51% being male. We have 773 hospitalizations, or 22% of the total number of cases. And included in the hospitalizations are 244, or 7% of the total number of cases that have been admitted to the ICU. This number is 32% of the total number of hospitalized cases. And lastly, of the 124 deaths, these represent approximately 4% of the total number of cases. Of the 4 additional deaths today, they are in 4 males, 1 in their mid-50s, 2 in the early to late 70s, and 1 in their late 80s. Of the 4 additional deaths, 3 did have underlying medical conditions. Also, of the 124 deaths, 44% are female, 50% are male. And regarding the race and ethnicity of this group, we have data for 96%, of the 124 total number. 61 or 51% are white, 42 or 35% are Hispanic or Latino, 9 or 8% are Asian, 4 or 3% are Black or African American, and we have 1 death in each of the groups, American Indian, Pacific Islander, and 1 individual of multiple races. And 5 of the 124 deaths had unknown race and ethnicity identified. Once again, our sincerest sympathies and condolences go out to the families of the deaths that were announced today. So regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 47 confirmed active outbreaks. Of the active outbreaks, 31 are in congregate facilities. This includes 2 new outbreaks since yesterday, representing 725 cases and 64 deaths, and 16 in community setting locations, and this includes 2 new outbreaks since yesterday, representing 140 cases and 5 deaths. Lastly, this is National Infant Immunization Week from April 25th to May 2nd, and this month is toddler May is Toddler Immunization Month. So vaccine-preventable diseases like whooping cough, chickenpox, and mumps are still present in our community, despite all of a majority of our focus being on COVID-19. And still, we want to make sure that our children's health are at the forefront and that they obtain all of their appropriate vaccine preventable or diseases. So I'd like to remind everyone that if your child is due for immunizations and/or a well child check, contact your pediatrician's office for further guidance, especially if your child is 0 to 24 months of age. And you can visit our sdiz.org website for information on our county San Diego immunization program. So again, everyone is making a tremendous sacrifice, so I really want to thank you. We are optimistic that the 5 metrics we are monitoring are trending in the right direction with your help, and we are being successful. As a quick reminder, tomorrow, May 1st, we will require everyone to wear a face covering when in public. So when you leave your place, please cover your face. Now please welcome back to the podiums Chairman Cox. Thank you.
Thank you, Dr. Wooten. We'll go directly to the questions. And again, as you were called up, if we haven't identified you by your name and your outlet, please do so when you're called.
Telemundo, please state your name and question. Telemundo, please state your name and question.
Oh, yes, Tanya Lubiano, Telemundo 20. Supervisors, why do you think the governor changed his mind and didn't close all the beaches when there was a very strong rumor that he was going to change all of them, and it seems like he changed his mind in just 12 hours?
Well, I'm going to let Supervisor Fletcher respond to that.
Thank you. You know, we've talked a lot about in the difficult challenges and environment we're in, there's a lot of information. It flows quickly. It often is not completely accurate. Sometimes maybe things get misinterpreted or miscrossed. The governor was clear today. He never had any intention to close anything other than Orange County. And so I think, you know, somebody perhaps got the wrong word and shared it, or things tend to take off and go. You know, I only know what the governor said to me, and what he said again here was that it was always his intention to close Orange County. But I think it's a good reminder for us all, myself included and every one of us, that when we hear something, we should wait until we get that from the actual source. We should pause, take a breath, and wait. If there's an official announcement that a city is going to make, the mayor will announce it. If there's an official announcement from county government, it will be announced in this forum. If there's an official announcement from the state of California, the governor likewise will share that. And so, you know, I think in San Diego, we're appreciative of all the work that San Diegans have done to ensure our beach opening has gone smoothly. We're incredibly grateful for the governor specifically highlighting what we're doing here in San Diego. And I would just like to see, as we move forward, that we continue to be the region that gets highlighted in a good way, and not the region that gets highlighted in a bad way. And so I think we all have our work ahead of us.
Okay, next question.
Alexis Riveras, NBC7, please state your question.
Yeah, with these restrictions being eased back on golf courses and parks, is this kind of, is the worst over?
Well, I'll try to answer part of that, and I think Supervisor Fletcher is going to have some additional comments. Obviously, the worst is not over. We're still dealing with a virus that's still out there, that is still being transmitted. But we realized, we asked the citizens of San Diego County to give us a month of April to try to see if we couldn't at least get things going on the right trend line. And I think we're encouraged by what we're seeing, and I think we feel that based on what we are seeing and the commitment that the people of San Diego County have made to keep their social distancing, now to wear face masks, that it's time to ease back on some of the restrictions. Supervisor Fletcher?
Just to add on, because this is a really important point, and it's really important that we all understand that the worst of coronavirus will not be over until we have a vaccine or widespread therapeutic treatment. Only at that point will we truly feel like we are out of the woods. From this day until that day, we are living in a world with coronavirus that is just as contagious, just as deadly, can have just as big of an impact at any single point. And so what we're counting on as we begin to ease restrictions is that each and every one of us have accepted the dangers, have internalized what that means for every one of us and how we go about our lives, and are willing to take the level of commitment and sacrifice that we put into the restricted time, that as we begin to ease out, that we channel that same energy and effort to, if you go out to a beach which you couldn't have gone to before, you're only going to go out to that beach with members of your household. When you go out to that beach, you're going to make sure that you ensure physical distancing. We're going to make sure that we diligently wash our hands, that we wear our face coverings. And if we do all of those things and we do them consistently, and we do them every single day, then we believe that we can limit the spread and not have a situation like many places had on the front end of this where they had rampant spread. But it is vitally important. Not only are we not out of the woods, we face the same danger today as we did in February and in March. The only difference is now we have in place procedures and things we do every day that can hopefully mitigate those a little bit. But to be clear, the stay-at-home orders remain in effect. You can leave your house for an essential job or an essential service. We do believe that getting outside and exercising by going to one of our parks or our beaches is essential if it is done properly and if it is done right. And so we continue to encourage the public to please, 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 let's continue to see this forward progress, and let's know that we all have to change our individual actions each day to lower the risk and lower the danger.
Okay, I believe we have one final call-on question.
Hunter Sowards, KUSI, please state your question.
Hi, yes. I was just wondering, Los Angeles has announced free testing to all residents there with no restrictions. Is this indicative of something that is going to be coming to San Diego residents soon? And then I would have a follow-up to that as well.
Okay, Dr. Wooten's going to respond.
Thank you for the question. If you will review our priorities, both state, federal, state, and local county priorities, really there's a lot of latitude there. Most anyone can get or obtain a test. So there is a lot of latitude with the priorities that we have here in San Diego, and we will continue with that process until further notice. Thank you.
The priorities being the first responders, healthcare workers, and those with underlying health conditions?
Yes, the priorities that we showed earlier in the week, there's one column that starts out with the federal guidelines or recommendations, then the state guidelines, and then we added a column that shows the county recommendations or priority levels 1, 2, and 3, and 4. And in priority level 4, that includes asymptomatics, but many in the county's priorities, levels 2 and 3 also include individuals that are symptomatic as well as asymptomatic. So we believe there is a lot of latitude with the priorities that we have set for it.
Okay, and Dr. Wooten, if you don't mind, will you just kind of share how you see us being able to move forward with these reopening steps without that aggressive testing that is available for really anyone who wants it?
Well, again, the priorities that we've set forward, pretty much most of our population, if you really review the document that we shared with you earlier this week, that really includes most individuals in San Diego who might want to get a test. So, and that is a very significant part of our strategy. Looking at the 5 metrics, which the last piece is robust testing, contact tracing, and isolation, and that feeds also, that's the federal guidelines, and that is the #1 indicator for the state's indicators for how the state is going to open up again and modify its stay-at-home orders. So I believe we have ample latitude. At this point, what our goal is to do is to achieve the daily goals of the targets that we want to test. And again, based on the priorities that we've set out there for our partners, we can reach that, and we are not limited.
Thank you.
Okay, we're going to go to the text questions now, and I understand the first two have to do with golf courses, so if we can go ahead and get those questions.
Yes, I'm going to combine Jay from the UT and Raphael from Channel 7. The proposed golf course physical distancing plan on the county site lists some adjustments to golf cart availability and use. Supervisor Cox mentioned at the start of the press conference there will be no cart use at all. Would you mind clarifying? Will carts be made available to seniors or others who need them? Are there any other differences between the plan posted now and what will be allowed on Friday?
Yeah, we had posted, I believe, earlier this week, a form for golf courses to fill out. It was titled Proposed Golf Course Physical Distancing and Safety Plan for San Diego County. As I recall, I think there's about 73 different golf courses in San Diego County. Some of those golf courses started filling out these plans and submitting to us. At that time, we were anticipating that golf cart usage would be limited to a single golfer, unless golfers are from the same household. That was included in that form, and the governor's directive today indicated that they were not wanting to have electric golf courts used. If people go out and play on the golf course in groups of no more than 4, they can do that. They can have their hand carts. They can carry their own clubs. But because that was not allowed by the governor's order, we will be striking that and basically getting a hold of those golf courses that have already submitted their plans and letting them know that that's a modification that they will need to accommodate.
Okay, next question from Alexandra Meeks with CNN. San Diego County has met 4 of the 5 criteria needed to reopen. What are some of the restrictions the county plans to ease first once the final criteria are met? What will be the course of action if the county meets all 5 criteria before Governor Newsom gives the green light to reopen?
Okay, Supervisor Fletcher is going to respond, or Dr. Wooten, or both of them.
Thank you. The 5 criteria were the federal criteria that were outlined, and we are working to synthesize the guidance that we get from the state of California and the guidance we get from the federal government. I think because we've seen general progress that we've made to date, we are in a position that we eased the restrictions around beaches. Today we eased around parks and boating and some outdoor recreational opportunities. From the beginning of this, we've said as we come out of this, it will be very slowly. We will take a small step. We'll have to monitor and measure the impact. And then we potentially, if it goes well, we could potentially take another small step. If not, we might have to pause. We might have to dial back. And so I think as we come out of this, it will be in a series of those small incremental steps. It is much better to come out slowly, thoughtfully, measuring the data, measuring the trends, looking at all of the impacts that we're having, assessing the capacity of our healthcare system as we move forward. And so the things that are within our control are a lot of those things that you see us begin to make small steps on, and we hope as a region to continue that forward progress. The things as it relates to the economy and jobs and what is essential businesses are guided and directed by the state of California. The governor has said he thinks we are weeks, not months away from moving into what they consider as stage 2. So we'll continue to monitor and look for advice and guidance from the state of California. But I think it's really important that everyone in San Diego know that there are a lot of very clear cautionary tales. There are a lot of very clear warnings about entities that came out too rapidly, about folks who thought that we were out of the woods, that the danger had passed, and saw second waves that often were significantly worse than the first wave. Here in San Diego County, I think we had a general flattening of the curve to start. I think we were a tremendous success story, much in line with what Singapore was. But we see what happens there. We want to be more the story of South Korea. We want to be more the story of those entities that as they begin to ease have had ongoing success and not huge spikes. And we want to learn the lessons, as we talked about multiple entities from 1918 that had to reimpose sometimes more severe restrictions and requirements after they thought they were out of it. And so the message to San Diegans is we want to continue to move forward. We want to do it thoughtfully. We want to do it based on the science, the evidence, the hospital system capacity, the trends, the percentages of positives, all the metrics that we share with you on a regular basis so we can do it. And some of that will be guided by the state government, and when that is appropriate, we will obviously work and coordinate with them. Some components of that will be our own local decisions.
And I also just wanted to add that the 5 metrics it's part of the whole planning process. Once we get the go-ahead from the governor, we have to be ready. And if we don't have those 5 metrics met, then we would not be ready to proceed. So the 5 metrics, they are part of the federal guidelines, and we are aligning those with the state's roadmap to modify the stay-at-home order, which includes stages. So currently, we are in stage 1, and in order to proceed to stage 5, these are some of the metrics that must be in place. And in order to proceed from stage 1 to stage 2, these 5 metrics are those that must be in place. And also at stage 2, if you review that, that allows a slow capacity for gathering, and I think it includes up to 10 people can gather. So we aren't there yet. As has already been stated by Supervisor Fletcher and the governor, we are within weeks, not months, but we want to be ready when that time comes, and we are very close to being ready. Thank you.
Dr. Wooten, I have another question. The county has announced effective tomorrow that face coverings are required anytime individuals leave their homes and come within 6 feet of another person who is not a household member. Will this be enforced at the beaches? And also, a follow-up question, how old should a child be who has to wear a mask?
Sure. So I'll start with the second question first. The CDC and the American Academy of Pediatrics recommends that children under 2 years of age should not wear a mask or have a facial covering. So we are including those guidelines in our order. So it would be for children 2 years age and older, not less than 2 years of age. And for the second question, must you wear, again, wherever you go, unless it's in the water, when you leave your place, cover your face. Have your face covering with you so that when you are within 6 feet or you see people coming and approaching you, place your face covering so that you protect yourself and you potentially protect the person that you're coming in contact with.
All right, thank you, Dr. Wooten. I actually, if you could stay there, I have a few coming in, all of them with a beach question, and let me see if I can find. There is a concern that Orange County residents will come down to use our beaches. What will law enforcement do to enforce visitors from out of town? Will street parking in beach neighborhoods be reduced?
So I think it's very clear for people, it's very important, rather, for people to understand that our beaches allow people to walk, run, bike, or horse ride, depending on where you are. But no one, not even San Diego residents, can put out a blanket and suntan and have a picnic on the beach. The beaches are not open for that purpose. They are open for people to walk through them, to have active activities. And also, if you have your household, certainly you could throw a Frisbee on the beach, but it really is not meant for people to gather. And that really is the major concept there. So individuals coming down from other counties or locations close by, whether it's to the north or the east or even the south of us, there will be enforcement of the social distancing order.
Thank you. Dr. Wooten.
Hi, thank you. Just to clarify one distinction between parks versus beaches. With our change today, at a park, a household unit could go and participate in an activity together, throw a Frisbee, play catch, do those types of things, but only at our parks. Those activities are still not allowed at our beaches. At our beaches, you can walk, you can run, you can move in a single direction. You can get in the water, participate in water activities, and get out. But that is all you can do. As it relates to overcrowding, whether it be someone from another county or folks from our own county, that is why our local jurisdictions have put in plans. They're working with their enforcement agencies, with their lifeguards, with their city staff to ensure physical distancing. And if there's ever a point at which physical distancing cannot be ensured, those jurisdictions will close that beach, or our public health officer will, or as we've seen with the governor will. And so we've done great. We've done really good. We just need to continue that moving forward, especially as we head into the weekend. Let's be responsible. Let's exercise some restraint, and let's make sure that we continue to move forward.
And Supervisor Fletcher, a follow-up from Matt Hoffman from KPBS. Did county officials get notice from the state, as the mayor's office said they did, that all beaches would be closing?
No, the county did not.
All right, thank you. Let's see where I am here.
Okay, next question.
Okay, this is from Aaron Leathley from Politico. What is the status of the county's implementation of the Home Meals for Seniors program the governor announced on Friday? The program is meant to connect seniors at high risk for contacting the coronavirus with delivered meals from local restaurants using funds from FEMA, the state, cities, and counties. Do we know what restaurants in San Diego will participate, how many people are eligible, whether a delivery system has been set up?
Okay, Supervisor Fletcher will respond.
Yeah, we're very encouraged by that program. The state announced it. We've been working with them to continue to get guidance about its implementation, and we've been working with local San Diego nonprofits, both those that can help facilitate the operations of that program and some of those that traditionally deliver food service, to get that up and running as quick as possible. We think it has a tremendous potential to be very impactful, and we will keep you posted as we move as swiftly as we can to implementation and rollout.
All right, thank you, Supervisor Fletcher. This next question is from Andrea Lopez Villafana with the Union Tribune. Yesterday it was mentioned that there would be a mobile drive-through testing site in southeast San Diego on Saturday only, and that the mobile unit will move to other neighborhoods next. How is the county notifying residents of the testing site on Saturday, and how often will it return to southeast San Diego?
Okay, Dr. Wooten's going to respond.
Thank you for the question. I think what we said earlier this week is that we would have a drive-through test site in southeast San Diego, and this is for Saturday from about 10 a.m. until 2 p.m. And we are exploring continuing that with the individuals that own the facility and the parking lot area. So we hope that we can continue to have testing in southeast San Diego. It may not be at that location, it might be at others, but we hope that individuals, and this is by referral only, so it is facilitated through the provider that we are working with to schedule the appointments. And we have approximately 30 appointments that are available for testing during this time.
Thank you, Dr. Wooten.
Well, that concludes our questions for today. We asked the citizens of San Diego County to work with us during the month of April, and you really have done a very, very good job. That's one of the reasons why we've been able to dial back some of the restrictions that we had previously. We're still going to need your help and cooperation to get through this crisis, so we ask you to continue, follow the directions. We hope you have a great opportunity this weekend to get out and enjoy some of the fresh air. Tomorrow's going to be a big day with a lot of changes coming, and I'm confident in our ability to continue to work to hopefully get us back to a new normal of some type. So that's it for today. We'll look forward to seeing you tomorrow at 2:30. And again, stay in place, maintain space, and cover your face. It's mandatory now. Thank you.